Good evening, everyone. And I realize that this is pretty late hour, but I promise you, if you all sit down and start listening carefully, we will be over by around 7 o'clock, perfectly on time for your dinner. So it's with immense pleasure that I'm sitting here today. My name is Veronica Manfredi. I'm the director for Zero Pollution, Green Cities, and actually also water management in the European Commission, DG Environment. And I have the honor to have with me this evening 4 eminent panelists. I'll start with Marcel Cardinali, who's sitting there. He said, I'm a bit different than others. He's an urban planner, actually, a researcher at a German university and cooperating with the Technische Universität of Delft. And he's particularly exploring pathways between green space characteristics and health. So very interesting perspective for many of us. Next to him is Dr. Cathryn Tonne. She is a professor of environmental epidemiology. I must tell you, this is one of the jobs I like the most in my own job, because it's often so difficult to make the links between all the human health diseases that you have been listening to and all the real root causes to that. And this is the specialization of Cathryn. She's cooperating with the Barcelona Institute for Global Health, and she's also the co-director of the Lancet Countdown for Health and Climate Change. For any of you sitting here, I suppose you all know what an important body the Lancet is. So really honored to have you with us. Next to her is Dr. Professor Robert McLeman. He is Professor of Geography and Environmental Study at the Wilfrid Laurier University of Canada. He is teaching and conducting research on the interactions between environmental change, demographic change, and well-being of households and communities. So I think you really come, Professor, with an extremely interesting perspective also on issues linked to migration, displacement, and security. What a topical issue. Also, I can tell you from a EU perspective right now. And last but in no way least, right next to me, I have the honor to be seated next to a lady who has been, amongst other, the president of Mauritius between 2015 and 2018. She's a professor, an author, and a biodiversity scientist, currently co-leading the Council Women Leaders since 2016, and classified in the Forbes list in 2016 as one of the 100 most powerful women in the world. I'm really impressed. So a big round of applause to start with for our panelists. As you see, they all come with different angles, and it's in the light of the very different angles for which they stand that I wanted to ask them a very key question. I think in all the previous sessions, and really many, many thanks to the speakers before, and we have been listening different angles of why human health is so deeply intertwined with climate, pollution. But let's face it, the science at the United Nations is super clear. We are facing a perfectly intertwined triple planetary crisis: climate change, pollution, and biodiversity loss. And science says these 3 crises are all underpinned by a very unsustainable man-made use of resources. So each of them are looking at this topic from different angles, but the key question I had for them today was, look, here in Europe, we are trying our best to tackle this. And basically, we have been trying since December 2018 with European Green Deal, various strategies, the Zero Pollution Action Plan, the biodiversity strategy, immense efforts to drive decarbonization and climate adaptation to set the ground. But what we witness is increasing polarization in society. We are just a few months ahead of elections, and it's not just in the EU. As we see, the globe is getting a little bit more of a polarized world as well. What can we do to continue tackling this triple planetary crisis in a less polarized manner? What would be your advice for the 3 key leverages to act upon in order to drive this necessary transition in the name of better health for all? So I will start maybe with Marcel. And please, you have 3 minutes.
Okay, yeah, as you probably noticed, I'm a fairly young researcher, and also I'm kind of exotic. I'm an urban planner here. but thanks for having me. So I learned a lot today. My perspective as an urban planner would be, as I'm working for the Urbanat project, so Urban Innovative Inclusive Nature, a Horizon 2020 project. We are working on how to get the urban transformation in social deprived neighborhoods going, so the most vulnerable groups. And we're working with so-called healthy corridors, which is a cluster of nature-based solutions, basically. And this is what my research and the research of the team that I'm leading on impact of NBS on health and well-being, what we are doing. So what we basically found is that it matters a lot how we design our urban green transformation. So it's not only about green spaces per hectare or green spaces per resident. It's just much, much more about how we design them. And what we found was that green corridors seem to be the most beneficial for most of the health pathways, at least the ones that we researched. So we have reduced air pollution, which was the most when green corridors were next to these residents. We have increased social cohesion when they were near to green corridors. We have increased mental health through social cohesion. And we have seen physical activity increase by a lot when these corridors are within 10-minute reach. So we have a lot of research done how to actually change things on the ground. And this leads me to my second area where I'm working is the 15-minute city, which I'm sure you all know. I like to call it 15-minute district because it's much more tangible and much more local. And also there we have a lot of health benefits, but what is maybe more important for this conference here is the change in climate-friendly behavior. So people are actually using better mobility choices and also eating healthier. They are being nicer to their local environment if they are in nature and if they are more outside, because what we built in the last 80 to 90 years is this car-dependent lifestyle where we move in our boxes and have no connection to the environment. And that is actually where I'm working at. And to conclude maybe now with the leverage points, I think it's one, if not the most important point, is to understand, at least we see that as urban planners, that the car-dependent lifestyle is not like a madman's idea from the 1930s. It's actually a response to health issues. So and why people are still thriving to these car-dependent lifestyle and thriving to achieve a better life in cities is actually a deeply democratic movement. So like a better life for all, for most of the society. If we look back 200 years, we also wasted resources, but only those few in the castles that could afford it. Now we are deeply democratic, and everybody has a very high lifestyle in most parts of the world. And we know now that 40 to 50 years that we cannot afford it. But that leads to transformational barriers, because this deep desire of a better life is still within the people. So that's why they oppose when you take their car parking spot. That's why they still move to cities. That's why they don't care so much if it's fossil fuels that are burned to move them around. Because I think that's the main leverage point is to, and one speaker said it before, it's to frame it as a health benefit. So actually using the same logic, a better quality of life for all is not like fighting climate change. It's like, we should put health at the forefront, and then we can also reduce these transformational barriers and get along with people to actually transition their urban environment to a better future.
Thank you, Marcel. Thank you very much. Somehow you're saying two things to me. First of all, really deploy certain green solutions on the ground, but on the other way around also, we have to take into account that souls and expectations have changed quite a lot. We have become all collectively very, very greedy. So on that second part, I think there is still work to do. Cathryn, I pass the floor to you. What is your take? What are the 3 key leverages on which you would play?
So we've heard a lot about the health co-benefits of climate change mitigation. That's one of my main research interests, I think, because it is extremely powerful to motivate more ambitious engagement with climate change mitigation. We've heard it referred to as an investment earlier by other speakers. It's really an opportunity and a sort of good news story that we can really use to get engagement and motivate different actors in society to essentially play a role in climate change mitigation, because we all have a role, from individuals to private sector, governments obviously, but I find people are too often just looking for the governments to do something, and we all have important roles to play in terms of climate change mitigation. And we have quite a lot that we already know. What are the most important sort of ways to get really large health benefits from climate change mitigation? You've heard about air pollution, phasing out fossil fuels. We know that would result in about 300,000 avoided deaths per year in Europe from phasing out fossil fuels, so really huge benefits. Similarly, by changing our urban transport systems to really promote active transport through walking, cycling, public transport, not electric cars, but active travel is really the way to deliver massive health benefits, but also free up our cities from congestion, free up that space that can be used for nature-based solutions, which we need, like in more tree canopies for adaptation, but also there are mitigation benefits there for reducing energy demand for cooling. So I think there's so much there that can be really motivating and empowering when people see that they have a very concrete role that they can take to contribute to mitigation, shifting to plant-based diets, obviously. So that's one, or sort of a package of levers, but I also want to emphasize what I see as, I'm an epidemiologist, but I see just such a huge role for the social sciences, are much more focused on how all this evidence that we already have, really connects with the policy process. Are people using it for decision making? If not, why not? How do we need to really reform the way we communicate about the knowledge that we have to really get more engagement, to motivate people so that they feel empowered and engaged? I've heard so much about the impacts of climate change today that people are concerned. They know about it. I mean, we know from communications research, people know it's happening, but that doesn't necessarily transform into pro-environmental behaviors. So what do we need to do in terms of the narrative and the communication to really foster that demand for change and the pro-environmental behaviors?
Many, many thanks for your input. And again, on the one hand, I see a lot of job for Marcel and his colleagues, because a lot of what you've been describing in the first part of the reply is really linked to urban transformation. And then this very, very important topic of indeed translating science into something that is easy to understand and also implement for policymakers as such. Many thanks for that input. And I would like to pass the floor to Robert. Professor McLeman, please.
Thank you, and merci beaucoup. Thanks for having me here. It's a pleasure to be here in Belgium. I'm going to speak about two issues of polarization, I guess. One is I do a lot of research on migration and displacement caused by environmental conditions. The Internal Displacement Monitoring Center in 2022 reported that over 30 million people worldwide were displaced from their homes by droughts, floods, storms, wildfires, and so on. The 2023 statistics will probably be out next month. I suspect they will be high as well. And obviously these have direct implications for people's health, physical and mental health and well-being, as well as for health systems as well, right? So we can think about the injuries, the food insecurity, the outbreaks of waterborne and insect-borne diseases that follow these sorts of events, and of course the mental health implications for the people who experience them. But that's the short term. The longer term is that people who are displaced often end up in a worse place, physically, geographically, or at least socioeconomically, as compared to before the disaster. They often end up living or trapped in places that are less productive, that may be more highly polluted, that may be more greatly exposed to consequent risks and dangers as well. And there is a an urge, it seems, in Europe, Australia, North America to vilify migrants and to try to keep them out at all costs if necessary. And it's a very harmful dialogue, and it's not helpful, especially in a changing climate where there will be more people for whom mobility is an adaptation option. But it's only an adaptation option if they are allowed and able to move through regular channels where they have access to regular employment, to benefits and protections as well. So that's one area I think where future research that looks at the direct and indirect health implications for migrants in a changing climate is important. The second one is I'm an educator. I teach undergraduate students in the hundreds each year. And I'm always careful, because I teach climate change and its impacts to them, to make sure that I always frame it not just in terms of the challenges, but the opportunities and the benefits and the pathways to a more adaptive and more climate resilient future. I think that a lot of messaging gets lost in the translation to younger folks, that they hear about the risks, but not so much the opportunities. We heard earlier today about climate anxiety and solastalgia. And so I think that polarization as well, there's a study in the New York Times that was published today saying that there is greater intergenerational separation than ever before. In other words, we don't communicate across generations as well as we once did. And so I think the findings and opportunities we discuss here today and tomorrow, it's important to make sure that we translate those into ways that are accessible to all generations. And just to finish by saying, my talk that I just gave right now, I actually just after the lunch, I recorded it on TikTok in advance and published it, and it's got about 900 views already since lunchtime today. And it's not because I'm any TikTok guru like Taylor Swift or anything else. It's just that my students, my undergraduate students, encourage me to do so. So now when I lecture, I put key concepts on TikTok as well, because let's face it, that's where they're going to be anyhow during my lecture. So if I'm popping up on their For You page, it's a way to do it. So thank you very much.
Thank you so much. Very inspiring also, because it's an immediate exemplification of translating science into policy somehow, because it is because of this TikTok, it is because of the impact that we receive from younger generation that ultimately also as European policymakers we are encouraged to take certain actions or not. So now it's the turn of Professor Ameenah, and I would like to ask you exactly the same question. See from your perspective, what are the 3 key leverages we should be acting upon? Please.
Thank you. First of all, thank you to the organizers for associating me with this very important conversation. It's a conversation that must be had for many reasons, but coming from the perspective of the Global South, there is something that I would like to just bring. It might sound controversial. I think it is time for us as a species here, I mean the human species, to really stop thinking that we can control the planet. We are not going to save the planet. We are going to save our livelihood, our space on this planet. And the planet has been here for billions of years, and we have only been here about 200,000 years. So what we'll have to do increasingly is see to it that whatever we do, we know is going to impact everywhere. So I hope that tomorrow's conversation, we will see the European narrative merge with the global narrative, because at the end of the day, we are one planet. And what happens in China or in South Africa will impact the rest of the world. We have seen already how migration emanating from Africa is already impacting the politics in Europe, and we're going to see more of that very soon. So what I'm trying to focus here is the impact that our action is having on biodiversity. Biodiversity, as we know, underpins our survival on this planet. Everything we do, everything we eat, everything we consume, the water, the plants and the animal, they all stem from the biodiversity law that has been given to us. But what we have seen over the past few years, rather, and we have seen that it is being lost, and people don't seem to care, or they don't realize. Just to posit one small example. I come from the Global South. I come from a country which is part of this biodiversity hotspot, which means that the plants and animals are there, they're found nowhere else in the world. They're unique. 1 square kilometer of a biodiversity hotspot has more diversity than the entire European continent put together. let us think about this. Now, if we are going to look at our survival, we've seen, for example, over the past 2 years during the COVID pandemic, how people were running around looking for new medication, looking for new treatment that is going to help give us cure immediately. But we all also know that the people from the global south, they have been treating their health otherwise. We know that traditional medicine has been at the heart of the health system practices in the global south. A country like Ethiopia, for example, depends up to 92% on plants. But we are losing that precious data. At the same time, we are losing the botanical law, the plant law, which is associated with this. So the impact of climate change already is being reflected in the loss of these precious plant resources. And when we talk about plant resources, I come from an island, small island developing state. Island communities occupy less than 1% of the global surface of the earth. And yet, these space provide 40% of the ecosystemic services for vulnerable people. And we look increasingly here, the narrative coming out of IPBES, even IPCC. We are hearing the term tipping point. And the tipping point means that we are precisely losing the ecosystem. We are losing the biodiversity. We are losing, and this is threatening our own existence on this planet. And people don't seem to care. People don't seem to realize that we increasingly need to get connected back to the earth, to Mother Earth. And just to end with one example, why we need to protect biodiversity in the face of changing climate, if you look at our own food security, we look at the production of seeds. Now, just imagine that there is an issue with a crop, a major crop coming out from, say, maize, for example, or something, and this gets destroyed. Where is going to be the resource that will help us address this climate crisis, this food security crisis? And just to give you one last example, there was a crisis in Canada where there was a rust problem with the barley. And the people have been able to get that solution from wheat species growing in Turkey. So we increasingly need to protect these seeds, so that it underpins our food security, it underpins our survival, it underpins our health being. Thank you.
Thank you so much, Professor Ameenah. And indeed, you are really stressing how much the biodiversity nexus as part of this tribal planetary equation is actually quintessential and as existential. This is something that we often forget as climate change itself. The two are so intertwined and truly, truly existential, and for us to look at with a different degree of attention. I very much like your reference also to traditional medicine. The European Union is trying to drive a policy of increasingly more toxic-free pharmaceuticals, and for all of you that may be following that strand of work, you know how difficult challenge it is. We have become extremely dependent on chemicals, and not that this is necessarily bad, but it has to be calibrated. We have some questions, and I invite you also to continue using Slido. I would like maybe to use one for Marcel. As you see, some colleagues, after having listened to you speaking, ask themselves the question, not difficult maybe to plant trees in city, but how can we really improve these accessible green spaces? You spoke of green corridors in sometimes pretty rigid urban fabrics that certainly we have on our continent, but not only. So what's your magic solution, Marcel?
Yeah, the magic solution. Yeah, I would first oppose to the first part of the sentence. Actually, planting trees in European cities is very complicated, because under our city is a complete another city of infrastructure. So taking away a parking spot, for example, and trying to plant a tree is very, very complicated, because the engineers will oppose. So that's one point. But of course, planting trees itself is not difficult. The accessibility issue is a rather complicated one, because the European city is built. It belongs to thousands of stakeholders. The plots are sold. So what we usually do, and when I advise cities, I was just in a meeting with stakeholders, local stakeholders last week in a smaller city in Germany. What we usually do is trying to come up with master plans and trying to have them put them in a strategic position to buy firsthand if a plot gets empty. But we can only see the benefits in a really long term. So, for example, Copenhagen with the finger plan, or Hamburg with the feather plan. These are strategic decisions made almost 100 years ago, and now you can see these green corridors because they never have been sold. Now to get them back is, again, a very long-term problem, which is not so easy as it sounds.
So quite a challenge, but we are happy to have people like you there to think about that. And many initiatives also driven here from Brussels, for example, in the new European Bauhaus. But again, from facts to deeds, it is quite a challenge. Maybe for Professor McLeman in particular, but also Cathryn, I see quite an appetite from the audience to further give us example of how to translate science into something that is really showing the opportunities for students now and next generations in general. Some other tips next to TikTok, if I may say. Do we have some views? Maybe Cathryn to start with?
Looking at this first question here about, what is it a communication issue? How do we ensure that the science is leading to more action in society? I think this is really where we need to focus so much in terms of the upcoming research agenda. We already know a lot. Clearly, there are many other, quite technical research gaps. We need to address those, but it's really on this knowledge translation process that I think we need to really understand that much better. And I don't think it's just communication. Communication is part of it, but I think it's also really understanding, working with political scientists, for example, or understanding the policy process, how evidence gets used. And I think working with, in really transdisciplinary teams with non-academic actors, actually, who are on the ground and know, sort of how, with lots of competing interests, things actually, are getting prioritized. So I think communication is very important, but it's not just communication. I think it's this whole knowledge translation process, which has many other disciplines in it.
Thank you. And your views, Professor McLeman?
I should start by saying I also noticed today that the EU has launched an inquiry into TikTok, arguing that it is by design trying to get young people addicted and reveal their personal information, which is probably true, but so does all social media, right? But anyhow, the point being, yes. In terms of communication, I think that, and this isn't just for young people, but for the general public as well. I think back to my own career, and I first started researching climate change and its impacts on coastal populations back in the 1990s. There was this whole, is climate change real kind of thing, and we've come a long way since then. There's still a few people who question it, but they're fewer and farther between and tend to think the moon is made of green cheese or whatever. But the point being is that we've come a long way, but we need to accelerate the knowledge translation from the academy, from the researchers, from the medical profession to the public. And I think that the medical profession in particular has been very good at advocating why climate change is a public health risk, and we need to support those folks who do it. And just a final point to pick up on my colleague here, I think tipping points and thresholds is a really critical thing we need to focus on as researchers, identifying what those are, both in terms of tipping points in ecology or in environmental systems, where we shift from a state that we like to a state we won't like, but also our own systems, our healthcare system, our economic system. There's a certain amount of stress that a healthcare system can take, and we saw that revealed during the COVID-19 pandemic. So again, identifying these thresholds and communicating them as well as a way to spur action, I think, is important.
Thank you very much. Do you feel, Dr. Ameenah, that actually we are sufficiently highlighting the positives of this story of transformation that we all stand for? Because I think tipping point is a message that I think many have got, and some of you have been mentioning. I mean, we have even issues of climate anxiety and other a feeling of being almighty that maybe is also spreading pretty quickly among certain part of the youth. And this is certainly not what we want. We want to show that it's now the time not only for understanding, but also taking action, even if taking action can be a bit difficult. But still, if everyone does it a bit, what's your take and what would you do, or what are you doing in your capacity also as a member of the Council for Women Leadership to drive this positive change?
I think this also comes to the question number 2, the strong relationship with nature for citizens focusing on climate change mitigation and communication. I think we really need to change the way we deal with nature. And so far, we have been quite patronizing as a species, and we really need to go back, because we need to respect nature. We need to appreciate also you've mentioned earlier on, the need for traditional issues. We need to go back to the knowledge that have been passed on to us by our ancestors. So it goes back to that respect that we must show towards nature, towards the knowledge, because these key indigenous knowledge is going to constitute the third way between the hard sciences and the tradition, and this is what's going to help us adapt. And this is the messaging that we have as policymakers, as leaders, to learn to communicate. We did with TikTok or the social media, it doesn't matter, but we need to use that to translate, also shape the policies that will help us in the future, in the near future, of course, short and medium term, to be able to handle the crisis which is in front of us, which is, of course, the climate crisis. Thank you.
Excellent. Well, there are other questions kicking in, but time is also running. So may I suggest I give 30 seconds to each of you to come up with your main message to the audience today in the light of what we have been discussing. Marcel, you're first in row.
Okay, I'll try to put it in research perspective. So I think we should work on accelerating transitions and reducing barriers. So what works, what doesn't? Does it look differently in different parts of the world? Likely. And if NBS are part of the solution for all 3 crises, is there a minimal dose, a frequency? Is there an overdose? We heard a lot about infectious disease today. And of course, more longitudinal studies. We need to show the impact in order to move forward.
Thank you so much. Cathryn.
Sure. In terms of what I see as important priorities for future research, it's really on better tools. So in terms of a lot of the co-benefits work has been done in modeling studies, but the tools are really good at modeling the technosphere, but they don't really do very well with modeling the behavior change pathways, which are really important. So there's a lot of work that needs to be done to really enhance the tools that we have that really are accounting for all of the different pathways that need to happen, and they're different actors. So we really need to sort of expand that modeling. It's not just cars, engineering, the energy system. There's a lot more going on. And as I mentioned before, I think the connection between the physical sciences and this more communication and social sciences to really understand how this evidence is getting used. We could have perfect models, but is that going to change anything on the ground? How do we really get much better at the knowledge translation part?
Thank you so much. Robert.
Thank you. First, let me commend the European Union for launching this initiative and taking action in terms of creating a new research agenda. So I'll add 2 things to the wish list for that agenda. One would be to think about, we do have the reality that climate change, biodiversity loss, pollution, they're combining to create risks, but how will demographic change in coming decades also affect that risk profile in terms of, age, mobility, migration patterns, urbanization? Because the reality is that Europe or the world 20 years from now, demographically, is not going to look exactly the same as it does today. So how do we weave that into research? And the second one is the focus on indirect pathways between these environmental challenges and well-being writ large. I mean, it's very clear that we know that with climate change, the spread of certain vectors will be greater in a geographical sense and then the exposure and so on. But what about the indirect pathways, things like solastalgia, things about related to food systems and food prices, and finally, livelihoods and cultural values, especially for indigenous and traditional peoples, and how these will be affected by a changing climate and how that will translate into health and well-being risks as well. Thank you.
Wonderful. Thank you. Bibi.
Thank you. Let us try and be as inclusive as we can. and I think you have just mentioned, our colleague just mentioned, immigration. This is going to be a very big issue. So let us try to be as inclusive as possible, show much more empathy, because people don't leave their homes because they want to leave their home. They leave their home for a reason. So let's try to be more empathetic. Let's try to be more human. Let us try to work with nature's system, because if we fail to work with nature and her system, I mean, she will fail us. And also, I think we have come to the final conclusion that she is demanding respect, and we should not be patronizing to think that we can control her. Thank you.
Thank you so much. I have no better words to conclude. The session was really about One Health, and I think the only message is we are literally one, all together, and with her, as you said. So on this note, and trying to, each of us in our respective roles, avoid polarization whilst making the case for the change, we are coming out of this session with a very strong mandate for continued action, and I count very much on all the scientists here to continue enlighten us all, here and globally. Thank you again.